Hi, my name is Amelia. I am a GHSP Global Health Service Partnership volunteer. I arrived in Malawi in July of 2016, and I'm currently living in the city of Mzuzu. So I have been working for the past year in Malawi as a nurse educator at St. John of God College of Health Sciences in Mzuzu in northern Malawi. I'm specifically teaching nurses and clinical officers about mental health psychiatric care. Generally on a medical ward, there's maybe 2 nurses per 50 patients, which is far different than settings in the United States. And I think in some rural settings where I haven't spent time, it's probably even more dire than that. The mental health setting specifically, there are far less people providing that kind of care. When I first arrived in the country, there were 2 psychiatrists in Malawi, and both of them were foreign. When I first started working with my students, they were in the clinical setting, so I worked with them one-on-one, but it wasn't like a big group, and it took a while to kind of form those relationships. And then coming into the last few months, actually my counterpart, the head of the department that I was working in, has been on maternity leave, so I've been in charge of a lot more, kind of running the department. And so my students kind of have relied on me for a lot of different things, and it's made those bonds much stronger. And just hearing them how grateful they are just to have someone who is always there, shows up on time, like even if it's maybe I'm not providing information that they couldn't get elsewhere, but just having somebody who's consistent and dedicated to what they're doing. And so just that kind of feedback from students has been the most rewarding thing. I am a nurse, I am a teacher, I am passionate about mental health care, I am Peace Corps Malawi.
Want more Peace Corps Malawi?
Hit subscribe.
Subscribe.
Now.
Do it. Please.